Well, tonight the U.S. has the dubious distinction of another world record, hitting more than 4 million cases of the coronavirus.
That's right, and far surpassing other nations, and now with more than 147,000 people who've contracted the virus and died. CBN News White House correspondent Ben Kennedy spoke exclusively with the U.S. Surgeon General. Ben, what did he have to say?
Well, John and Jenna, the Surgeon General hit on everything from the administration's plan to safely reopen schools and churches to vaccines and treatments for COVID-19. Dr. Jerome Adams expects things to get worse or stay at current levels for the time being. He warns the country can't test or treat its way out of the problem, so it's up to people to help stop the spread.
Well, the latest about this virus is that we know more than ever about how to actually control it. I talk about the 3 W's all the time. Wash your hands, watch your distance, and wear a face covering like I'm doing right now. If we do these 3 things, there's actually data out there, studies out there now that show us that we can effectively slow the spread of coronavirus and safely open schools, safely get back to worship.
Do you think the virus can be eradicated?
Well, we don't know about eradication, but we know that we can stamp down the level of spread enough that we can get back to some sense of normal. So Italy, for instance, one of the hardest hit places in the world. Just 2 months ago, we were talking about people dying in hallways in Italy because the healthcare system was overwhelmed. They're now playing soccer games there. They're now having tourism come back again. They're now opening schools. And this virus course is about 1 to 2 weeks in the average person, which means if you take the right steps now to prevent spread, as a nation, you can see dividends in as little as 2 weeks. We can turn this thing around very quickly. There's evidence out there.
Right now, Dr. Adams, several vaccines are in human trials. Do you expect or do you think we'll see a vaccine in the fall?
Well, I talk to Tony Fauci every day or every other day, and he still is very confident that we will have a vaccine by the end of this year or the beginning of next year. But I want people to understand that's step 1. Less than 50% of adults in the U.S. get a flu vaccine. So we can have a vaccine that's safe, we can have a vaccine that's effective, but if only half of Americans or even fewer in certain populations are accepting of it, then it's not going to help them. We need to work on vaccine confidence. At last estimate, it was over 4.2 million children who were behind on their vaccinations because of the virus. So we're worried we're going to see resurgence of vaccine-preventable diseases like measles, mumps, rubella. The World Health Organization actually has looked at this on a global scale, and they're looking at millions potentially of deaths around the world from the shutdown because people are falling behind on both vaccinations and on diagnosis of infectious diseases that go beyond COVID, like HIV and malaria.
Right now we are wearing masks. How important is it for the public to take the same approach?
It is incredibly important that the public realizes the importance of wearing face coverings. This has become politicized, and I think people need to understand that all politics aside, all of us benefit when we wear face coverings.
Right now, lawmakers are working on the next round of relief. What would you like to see in the bill?
Well, we want to make sure we have the resources available from a public health capacity to be able to respond to this outbreak. We want to make sure we have enough testing available for people and that we can decrease turnaround times. And I want the American people to know that we are working on that. We're increasing availability of point-of-care testing, which returns results in 15 minutes.
Do you expect things to get worse in the country before it gets better?
Well, based on the current trajectory, we do expect things to get worse or stay level for a while because we know that cases are the first thing you see. The second thing you see are hospitalizations. The third thing you see are deaths.
Dr. Adams, you are a religious man. What is your advice to churches, to people, places of worship?
Well, I talk to churches, I talk to places of worship, I talk to faith leaders all the time because they are in communities. And I just want to applaud them for being innovative, providing ways to keep people connected even though they're socially distant. We know that our worship is a source of strength for many of us in trying times. And I really want us to really focus on those public health measures we can promote that will allow us to get back to in-person worship, focus on those social determinants of health, And we know that in many cases, our churches, our synagogues are really the places that help provide food when people are hungry, that help provide clothing when people don't have it, that help provide housing for the homeless. We just want to underscore how important those aspects are. And I just ask people in the faith community to continue to pray for me and to pray for our leaders and to pray that we have the wisdom that we need to help fight this virus, that we have the humility to understand where we've been wrong based on what we thought we knew about the virus and to course correct, and to pray that we have the words to be able to help Americans understand the role they can all play and to keep the politics out of it because we're all in this together.
Now, Dr. Adams said more than 50% of COVID cases is spread by someone with no symptoms. That's why he keeps pleading for the public to do the 3 W's: wash hands, watch your distance, and wear masks.